I wanted to explain to you the Well Elder assignment. The purpose of this assignment is for us as nurses. We have this particular need to have exposure to well elderly clients to assess all dimensions of health, to evaluate any specific needs, what community resources are available, and to describe the nurse practice implications appropriate to that well elder client. Throughout your education, you've been exposed to elders in the hospital environment, which is just a very small population in general. And as the Affordable Health Care Act moves forward and we as nurses step closer and closer to the front lines of health care, we're going to be out there doing a lot more of this. So this purpose of this project is to provide observational experience for the student in the community that meets the need of the well elderly. And the objectives are here as below, and they are objectives that you will find in the syllabus like I explained before. These are your objectives. So you're going to select an older adult who's 65 years, I would prefer greater than 70, but 65 or older. They are not a relative. So if you have a grandpa that's willing to do it, tell your friend in class to talk to your grandpa, but you cannot do your own relative. That they have to be independent in their living arrangements, and they have to be able and willing to answer questions. You must make arrangements to meet with this adult at least 4 to 6 times prior to the 1st of November. And all visitation reports are due the first Tuesday following your visit. So during the first meeting, you're going to describe the assignment and set your parameters and ensure that the participant understands the assignment, and the completion of the assignment will terminate with your visits will terminate at that point. You don't want them to think you're going to be going there over and over. So you will get a participation agreement signed by them and hand this hard copy in to me, and I will call them and verify their participation so that there are no fictional characters made up here. Not that I think you would do that. So the first, you're going to establish your relationship with introductions, you're going to review the purpose, and you're going to share the Well Elder assessment tool, which is, this is the assessment tool here. And this is, let me see, this is their copy. So you're going to give them this one, and they can follow along with you. Your copy is a little bit more extensive, where you're going to complete this in a typewritten fashion. All of these will be submitted to your clinical instructor the Tuesday after the visit. So you're going to do a nursing evaluation in 5 sentences or less. How would you rate? Describe this older adult's current health status. Use a scale from 1 as poor, 5 is excellent. So you're going to do a little 5 sentence or less narrative there, evaluation. You're going to continue to do that, and then after everything, you're going to do a little evaluation after each component. Spirituality, nutrition, is that physical health, health perception and health management, and social health. And what's indicated here in red is prompts for you to ask them. And this is pretty self-explanatory. Sexuality. Old people have sex. This is part of it. And then you're going to say, this ends a formalized interview process. Do you have any questions you would like to ask me? Thank you for helping me. I would like to come again and visit with you. Can we set up a date and time? So you're going to set up a time for the next visit. You're going to bring all this stuff home, type it all up, and then do your summary evaluation. And that's the document that's submitted on the first meeting. So they can keep theirs. You're going to do different meetings where you're going to talk about different things. So a home and safety environment. At the top of each of these documents is a hyperlink for you to open, and it will take you off to, why does that not want to open? Let's see, there it goes. And it takes you off to this excellent website that I've used many times in the past. And this pops open at consultjerryrn.org. The fall risk for older adults, Hendricks 2 fall risk model. Read through that. And then you could do the fall risk on this patient. So that would be for your home safety, and then you're going to answer these questions in a paragraph format. Some little tips: be sure to admire and praise the home during the assessment. The patient will not, so they will not feel embarrassed or humiliated by hazards or risk. Be kind. So that, and then you're going to, so that's the home safety. Did I open that one twice? I guess I did. And there's going to be on health education. So there's another hyperlink to open. One on reminiscence. And health promotion. So really only once are you going to have to be in their home. You could make plans to, the one in their home is this one here. You could make plans to meet them for coffee, to do some of these other documentations. Okay, so let's get back to our assignment. So as you can see, you can do them in no particular order. You just have to do that first one first. They're 15 points each, and then there is a final reflection, synopsis, evaluation, recommendation, and that's 1,000-word minimum. And I believe that's just going to be done on your own. I don't think I have a guideline for that one up there. These are all those documents. There are criterions, which is grading rubrics for how everybody will grade these. And then you're going to do a final 1,000-word paper on your final reflection, synopsis, evaluation of the experience, and recommendation for that individual. So like I said here, all visitations shall be in essay format. You're going to submit them via Blackboard to your clinical instructor. The pardon me, grading criterion on the reports is on Blackboard. It's also up there. You need to dress professionally in street clothes, no jeans. Take your MiraCosta name tag. Follow our dress code guidelines. And during your final visit, thank the participant and make sure to terminate the student-nurse participant affiliation. So you're going to be terminating your relationship with them. I think this is going to be a very exciting assignment. It might feel a little daunting to you, but it is good to see what our patients are like when they're healthy and in their own homes.